Are you over 60 and love walking to stay active? That's fantastic. Walking is one of the best things you can do for your heart and overall health. But what if I told you that walking alone might not be enough to keep you strong, stable, and fall-proof as you age? It's true. After 60, our bodies change, and we start to lose muscle mass and balance more quickly. While walking keeps our endurance up, it doesn't always target the key muscles we need for stability and strength. Many orthopedic and rehabilitation experts have found that certain muscles, especially in our hips and legs, get a bit neglected during our daily walks. This can lead to weaker joints, a higher risk of falls, and that feeling of unsteadiness that so many of us worry about. That's why today, we're going to talk about a game changer for senior fitness. It's not about giving up your walks, it's about adding something simple and powerful to your routine. We're diving into the world of chair exercises. Don't let the name fool you. These aren't just for people who can't stand. Chair exercises are a secret weapon for building strength exactly where you need it, without putting any strain on your knees or back. They are a safe, effective way to activate those supportive muscles that walking often misses. Think about it. Have you ever felt a little wobbly, even after a good walk? Or maybe your knees or hips ache, making you hesitant to do more? That's where chair exercises come in. They provide a stable base to the chair so you can focus purely on strengthening the muscles that support your balance and protect your joints. This means you can build power in your legs and hips, improve your stability, and drastically reduce your risk of a fall, all from the comfort and safety of your own home. No fancy equipment, no gym membership needed. Just you, a sturdy chair, and a few minutes of your time. In this video, I'm going to teach you one incredibly powerful chair exercise that will do all of that and more. We'll go through it, step by step, making sure you do it safely and effectively. We'll talk about which muscles you're working and why they are so important. We'll also cover how often you should do this exercise to see the best results, and who might need to modify it or speak with a doctor first. And just a quick reminder, this video is for educational purposes. It's always a great idea to check with your healthcare provider before starting any new fitness routine, especially if you have concerns about your joints or balance. Ready to feel stronger and more confident on your feet? Let's get started. So, let's get into the exercise itself. First, find a sturdy, stable chair without wheels. A dining room chair is perfect. Sit toward the front edge of the chair, with your feet flat on the floor, about hip-width apart. Your knees should be bent at a 90-degree angle, directly over your ankles. Sit up tall, engaging your core muscles to support a straight spine. Imagine a string pulling the top of your head toward the ceiling. Rest your hands gently on your thighs or on the sides of the chair for a little extra support if you need it. Now, here's the movement. We're going to do a chair-based leg extension, but with a focus on control. Slowly, and I mean slowly, extend one leg straight out in front of you. As you lift, focus on squeezing the big muscle on the front of your thigh, that's your quadriceps. Lift your leg until it's as straight as you can comfortably get it, but don't lock your knee. Your goal is to feel that thigh muscle working hard. Hold it there for a count of 3. 1, 2, 3. Feel that muscle engage. Great. Now, just as slowly, lower your foot back down to the starting position. Control is key here. Don't just let your leg drop. Once your foot is back on the floor, repeat the same movement with the other leg. Slowly lift, squeeze that thigh muscle, hold for 3 seconds, and slowly lower it back down. That's 1 repetition for each side. The magic of this exercise isn't in how fast or how high you can go, but in the slow, controlled movement. This deliberate pace is what builds strength safely and effectively, without putting any stress on your knee joint. It isolates the quadriceps muscle, which is crucial for standing up, climbing stairs, and stabilizing your kneecap. So, which muscles are we actually strengthening with this simple move? The primary muscle group at work here is the quadriceps, located at the front of your thigh. This is one of the largest and strongest muscle groups in your body. Strong quads are essential for almost every lower body movement, including walking, getting out of a chair, and climbing stairs. When your quads are weak, your knee joint has to take on more stress, which can lead to pain and instability. By strengthening them with this exercise, you're building a natural knee brace that protects your joints. But it's not just about the quads. As you sit up straight and keep your core tight throughout the movement, you're also engaging your abdominal and lower back muscles. A strong core is the foundation of good balance. It acts like a central anchor, helping you stay steady on your feet and preventing those unexpected wobbles that can lead to a fall. So while it looks like a simple leg exercise, it's actually a fantastic movement for building core stability at the same time. You're getting a double benefit with every single repetition, strengthening both your legs and your midsection. Now for the big question: how often should you do this exercise to see real benefits? For seniors looking to build strength and improve balance, consistency is more important than intensity. I recommend starting with 2 to 3 sets of 10 to 15 repetitions on each leg. Aim to do this exercise at least 3 to 4 days a week. Remember, a repetition is one full movement, lifting, holding, and lowering your leg. So you do 10 lifts with your right leg, then 10 lifts with your left leg, and that completes one set. Take a short rest, maybe 30 to 60 seconds between sets. Listen to your body. If 10 reps feel like too much at first, start with 5 and gradually work your way up. The goal is to feel the muscle working, but not to feel pain. You should feel a gentle fatigue in your thigh muscles by the end of your sets. That's how you know you're building strength. As you get stronger, you can increase the number of repetitions, add another set, or even add a very light ankle weight if you feel ready and your doctor approves. But even without weights, doing this consistently will make a huge difference in your daily life. Now, it's very important to talk about who should be cautious with this exercise. While it's generally very safe, there are a few situations where you should either modify it or consult a healthcare professional first. If you've had a recent hip or knee replacement or any other type of lower body surgery, you must talk to your surgeon or physical therapist before trying this. They will give you specific guidelines on what movements are safe for you during your recovery. Also, if you experience sharp pain in your knee, hip, or back while doing the exercise, stop immediately. A little muscle fatigue is normal, but sharp pain is a signal that something isn't right. For those with balance issues, make sure your chair is placed against a wall so it can't slide backward. You can also have a sturdy table or countertop nearby to hold on to if you need extra support. If you have severe arthritis, you might find that you can't fully straighten your leg. That's perfectly okay. Just lift your leg as high as you can without pain. The effort of engaging the muscle is what counts the most. The golden rule is always to listen to your body and never push through pain. Safety first, always. Finally, let's talk about simple daily habits you can incorporate to stay mobile and active, in addition to our chair exercise. Think about finding small opportunities to move throughout your day. For example, when you're watching TV, stand up and sit down a few times during each commercial break. This is a great functional exercise that strengthens the same muscles used for getting out of a chair. Another great habit is to practice standing on one foot while you're waiting for your tea to brew or brushing your teeth. Hold on to a counter for support, and try to hold it for 10 to 15 seconds on each leg. This is a fantastic and simple way to work on your balance every single day. Don't forget to stretch. Gentle stretching helps maintain flexibility in your joints and can relieve stiffness. Try a simple calf stretch against a wall or a gentle hamstring stretch while seated. And of course, keep up with your walks. Combining your daily walk with targeted strength exercises like the one we learned today gives you the best of both worlds: endurance from walking and stability from strength training. It's this combination that will truly help you stay strong, independent, and active for years to come. Thank you so much for joining me today. I hope you found this chair exercise helpful and feel inspired to add it to your routine. Let me know in the comments, do you prefer walking or do you enjoy seated workouts like this one? I'd love to hear from you. If you liked this video and want more health tips, specifically for seniors, please give it a thumbs up and subscribe to the channel. Stay active, stay strong, and I'll see you in the next video.